the students are working on real-life patient care from first year, so they are having the expectation of the times required. In terms of the practical management in the clinic, we have guidelines around, I guess, the process, and in terms of teaching the time management, that's probably guided more by each group's mentor at the time. But it's, I think in all practice where people are learning, the time for one person to do one procedure is going to be much longer than another person perhaps. So there is also some flexibility and extended length of time around cases. But from the dental technician's point of view, we pretty much have the same time frame for turnaround of work as what the commercial laboratory is requesting for that same case. Because otherwise we're building a false expectation in our graduates, and when they go out into the workplace, they're not ready. So this has been from feedback from employers who really want us to get the students more time efficient. So I think, is that? Yes.
Another question currently being developed. Okay. Getting students to learn the basics. In our experience, students want to run before they can walk. We have a hard time getting them to learn the basics well before the advanced skills. Can you comment, please, on adapting your educational system to get them through the more mundane basic skills?
That's a really good question or problem that you pose. And I guess it's building those competencies in the early years and including communication and professionalism in those basic competencies that the dentistry students are doing in the simulation lab and in their simulated cases. So I guess by, I mean, sometimes in dental technology we'll say, well, when the student is confident, they can do a patient case. But of course, that's not always ideal. Confidence doesn't equal competence. So I guess as educators, we make those judgments around that. But by including the third year's students in the team-based treatment planning, it also shows them what's happening in the more experienced years and also with their mentor. And so it sort of puts it a little bit in perspective of where they're coming from with that knowledge. And I think the underpinning in things like oral biology and the drawing of the teeth, the tooth carving, all these things that we're developing the manual dexterity skills in some of those earlier courses, the students are learning those together. So there's a sense of connection in that early stage, but there's certainly also, I think, looking at that individual and where they come from and what skills they have before moving on. But there's no doubt that those initial skills are important to build on for the future.
Yes, can you hear me? Okay.
Yes.
First, thank you for your presentation, both for the content and your passion for this important area. My question has to do with the outcomes, particularly not only patient outcomes, but the student or educational outcomes. And before I frame the question, as Dean, I'm personally involved. I've been a facilitator more than 4 years, and we have these wonderful, rich discussions, but we get all done, and I turn to the students, I say, okay, we're done. What did you come out of this with that's going to make you a better dentist? And I'm not sure we're there yet. And I think an important area we're kind of headed towards is can each person pull the main perspectives of each other healthcare provider and focus it on this patient? And I wonder if you know how far along are we? Because my concern is, right now I'm saying, we got to do this because it's important. We got to do this. But I think it would be better if I can say, here's a skill set you're going to have when you get done that's going to make you a better dentist. And that's where I think would be a good direction to head. And I wonder if you could comment. Thank you.
Yeah. Talking about the skill set, one of the things we've been getting the students to do is look up at the jobs on the online job market and look at the qualities that an employer is looking for. Those qualities are usually good organisational skills, professional approach, good communicator. So they're not saying I want a person who can drill a fantastic cavity, you know, with parallel walls or something. They're asking for some attributes, and I think that's helping turn the students' perspective of what is also important in their education, that it's not only the theoretical knowledge and skills that they're developing, but the whole attitude that they're coming in with. And in their approach, when you see the dentistry students coming into the laboratory, at first, in the early years, it's like, oh, this is a zone not familiar to me. But by fifth year, they're coming in and out and in and out, and they know their role is to take a really good impression, you know, and get all the detail so that then influences the outcome with the dental technician. So I think they're still with themselves in their own mind of their role, but it's considering those other roles and where they can use or refer work as well. And I think that's the beauty of our schools, is that you know, referring work and making connections is an important part of the students' progression, and being comfortable with communicating with the various people that they then have to deal with. So, yeah, has that answered the question, do you think? Or? Yep. Yeah, that would be a fantastic, and that's the true interprofessional learning. I mean, the interprofessional learning of having just our dental professions coming together is one stage. The next stage is then for getting us with the pharmacy, physiotherapy, and already we're embedding these things in dental programs. But I don't know that the student is seeing the relevance of it yet or wants to engage it, and faculty as well. And we have, at Griffith, we do have a strong interprofessional group, and with medicine, pharmacy, physiotherapy, we've got an ideal setting. We're all in the one building. Referrals can happen easily. But there's a lot of resistance, you know, if we had a solution, we'd be, yeah.
I'd like to know, thank you very much. I'm sorry I was not at the beginning. I was at a different meeting. But I would like to know, are your students educated in the same premises that the dental student? Are the dental technology students are educated in the same premises and the same school as a dental student?
Yes, in the same building, the same teacher for the basic sciences, and then we have the prosthodontist will teach some things to the dental technician, and the dentistry dentistry students. The dental technician will teach some things to the dentistry students. So we have a lot of crossover with, yeah.
And do the whole staff of the dental school, I mean, including the dental teacher, the technical dental technician teacher, practice teamwork when doing to structure the curriculum?
To a degree. Not everyone's as passionate about it as I am, but we have a good many people on staff that engage in it. So, and it's a thought, it's embedded in the curriculum, so it's on agenda items, it's always alive. But there's people that think, oh, why do we have to do this? Do we need dental technicians here, really? Like, you know, it's, there is still some of this difference. But on the whole, I think it's working. I mean, it's improved a lot from where, when we started, we were just 4 keen people. But then as more people come in, they then come with different mindsets of how this should operate or how we should have a dental program or what a dental program looks like. So it's challenging to many people. We have very good support, though, from the health executive, and and I think that's what keeps it alive, because you could see before the small numbers of the dental technology program. And it's a big change in Australia. This is the first bachelor degree for dental technicians. It's always been in a technical college, but you know, this is a change that's occurring. So yeah.
Thank you.
Thank you.
Very much, Dr. Evans, for your presentation. And now we continue with the topic-related oral presentations, which will last Thank you. Thank you. Which will last for an hour. Each presentation lasts for 15 minutes, including questions. And the first one is entitled Seeing is Believing, Using Videos for Assessment of Communication Skills, and is presented by Dr. Ivy Peltz from New York University College of Dentistry. Dr. Peltz? Is Dr. Peltz in the audience or no? We could continue with the second presentation, which is Dental Students' Self-Perceived Skills on Communication for Patient Motivation, a long-term survey. And the presenter is Dr. Christoph Ronseer, whom I have seen earlier in the room. Yes, Christoph. The topic-related papers? No. That's Thursday, 12 o'clock, topic-related oral presentations.
Hello,
So
everybody. Third
yes.
time lucky.
Yeah. We will continue with the third one, and in the meantime, we'll try to recatch numbers 1 and 2. The third one is the triadic dental visit and the teasing nurse, exploring the dividend of an interactional approach to communication in dentistry by Dr. Angus Kelly from Dublin Dental University Hospital in Ireland.
So hello, everybody. My name is Angus Kelly, and I'd like to talk to you today about presenting a little bit of research that I've recently completed using discourse analysis to explore interaction in the dental surgery, communication, and then to consider how that might be relevant to dental education. So the traditional model for interaction in dentistry looks something like this. This is based on a diagram by Candlin et al. Back in 1980. And it talks about the dentist as the central participant in an interaction. So the patient, certainly, and even the nurse, they're very much they play second fiddle to the dentist. They almost speak when spoken to. What we'd like to present today is an alternative paradigm, a triadic model of interaction. In this model, certainly the patient has a much stronger role, but I'm going to focus a little bit more on the role of the nurse as well, as being very actively involved in the interaction. And I think this model perhaps reflects a little bit better a more contemporary patient-centered interaction that we might experience today. In this model, I'm going to refer to what sociologist Irving Goffman refers to as footing. Footing is the alignment people take up to each other and to what's talked about during an interaction. So in this model here, at a given moment, the dentist and the patient might be more closely aligned, where the nurse is more sidelined. A few moments later, the nurse and the patient might be more aligned, with the dentist sidelined, and so forth. And the proposal is that these alignments shift frequently throughout the course of an interaction. And a better understanding of these shifts of alignment make for a better understanding of communication. So I'm going to present a few small excerpts from my research